Welcome to Digital Damage Control. Learn more about how to use social media, internet and tech in a healthy way. Today we will talk about how digitalization affects your health and what you can do about it. What is digitalization? The term doesn't have a single clear definition. Some people say it is the use of digital technologies to change a business model, and others describe it as a way in which many domains of social life are restructured around digital communication and media infrastructures. When I use the word digitalization, I mean the increasing use of digital technologies in our everyday life. I don't think that the digital transformation of business and social life should be separated, but should be rather seen as one big process. The permanent move from the real physical world to the digital non-physical world. On the 13th April 1993, the European Laboratory for Particle Physics called CERN put the World Wide Web software in the public domain. Suddenly, everyone who had a PC with internet connection and an internet browser installed could gain access to the internet. If we fast forward in time, we can see that the World Wide Web has changed quite a lot since 1993. People have the possibility to generate and upload content themselves and don't only act as receivers. In October 2020, almost 4.66 billion people were active internet users, encompassing 59% of the global population. The internet penetration in the world can vary strongly depending on the region. North Europe, for example, had an online penetration rate of 95% in January 2020, whereas in East Asia the online penetration rate stood at 63%. Even though internet access and availability can significantly differ depending on the region, the rapidly growing influence on individual consumers can't be denied. Looking at the Wuhan coronavirus restrictions worldwide, it also seems to have boosted the time we spend online when working in home office or studying, meeting up with friends or consuming media. Because of all those factors, it is important to look at effects that digitalization has on your health. Today we want to focus on the physical health aspect. In part 2, we will look more closely at the impact on your mental health. Be sure to subscribe to not miss the upcoming video. There are many smart devices you probably use on a regular basis. Your smartphone, laptop, desktop, iPad and much more. Because the health effects of smartphones, tablets and mobile gaming consoles are pretty much the same, let's just put our attention onto smartphones. This also applies to laptops, desktop PCs, TVs and stationary gaming consoles, which are here just summed up as PCs. The difference to the smartphones is that the PCs can't be so easily taken on the go. The third category I want to add are the headphones. They can cause health problems which are way different to what can be caused by smartphones or PCs. One of the biggest physical health problems caused by smartphones is probably eye fatigue. This is kind of not the phone's fault. This just happens through too extensive smartphone use, or when you watch content at night. Have the display very near to your eyes the whole time, and maybe also when you're outside in the bright sunlight, when looking at the reflecting display. The symptoms of eye fatigue are muscle fatigue around your eyes feeling very dry, burning, stinging or irritation. Eye strain is caused through an intense focus on your display for a longer time without taking breaks that help your eyes to relax, through bad lighting conditions, a lot of UV light exposure and possibly also through blue light exposure. So for extensive smartphone users, which I think most of us are, try to apply this. Make sure you always have some lights on when using your phone in the dark. Enable the night mode on your phone, which reduces the amount of blue light you are exposed to and stresses your eyes less. Don't use your phone in direct sunlight for a longer time. Every 20 minutes, stare at a point that is 20 feet away for 20 seconds. This helps your eye muscles to recover and your focus to regain. An even bigger health problem emerges when you use your phone while driving car, riding bike or going for a walk in high traffic areas. Being distracted through your phone when driving car can cause the death of many people. It is difficult to track the number of accidents caused by cell phone use while driving. Unless the driver admits to having used the smartphone while driving, law enforcement often cannot report the exact cause of the accident. This is why it only can be estimated how high the numbers of car accidents are that get caused through smartphone distraction. Luckily, there is a study from the University of Utah examining exactly how big of a distraction your smartphone really is. The results of this study were published in 2015. They found out that a driver traveling only 25 miles per hour continues to be distracted for up to 27 seconds after disconnecting from a highly distracting phone and car voice command systems. In the test, the people didn't even have the phone in their hand and were distracted for 27 seconds only through voice command. 27 seconds where you're unable to react to unexpected situations in traffic. When driving 25 miles per hour, you by then would have covered 3 football fields, and all this way you would be a security risk for everyone around you. In another test, people texted with their smartphone while driving. Sending a short text message caused another 30 seconds of impaired attention. You want that? No, you don't want to run somebody over or harm you and other fellow passengers. So what can you do? Don't use your phone while driving. It's that simple. Don't even have your phone somewhere near you. As a study from the University of Chicago shows, the mere presence of your phone, even if you don't get notifications, can already cause the lack of attention. Let's now look briefly on other problems your phone use can cause. You may get sore hands through the extensive use of your touchscreen. Not only your eyes need rest, the same applies to your hands. Through a wrong posture, your head, neck and back could be hurting. Do exercises that relax the muscles in those areas, or avoid long watch times on your phone in the first place. You could get sick through bacteria, viruses that happen to exist on the surface of your smartphone. So disinfecting it on a regular basis, like once a week, should help. Let's now look at health issues that are primarily caused by desktop PCs or laptops. Depending on the device you have, the display is very low, so that you have to bend your neck and back. Using your PC at work, in school or when studying often means that you stay in the same bent forward position for an extended period of time. This causes neck tension and your back may hurt. Doing leg and back relaxing exercises for 10 minutes each day should make a great difference. If you find it hard to start, then maybe begin with 1 day in the week and then scale up. The positive outcome is worth the hustle. Another thing that is especially useful for laptop users: buy a laptop stand. This allows you to raise the height of the display you sit in front of. In order to be still able to work, you should buy a separate keyboard, which you can position in front of you, and a mouse which replaces the trackpad. Getting sore hands is another typical problem that occurs when you use your PC for an extended period of time. There are different measures you can take. The key thing to consider is: take breaks in your PC usage time, so that your hands and fingers can relax. Massage your hands a bit and do stretching exercises when your hand and fingers hurt. Another essential thing you should do is to make sure you have an external keyboard with a decent amount of travel, as well as an ergonomic mouse on which your hand can rest on and which feels comfortable in use. Try to avoid the use of trackpads when the tasks can also be done with a mouse. Digital eye strain is another major problem you get on your PC when using it for an extended period of time. In order to keep it by a minimum, you should have your display placed between 50 and 70% away from your face. If you use your computer on a daily basis, you should also consider using a matte display that doesn't reflect so strongly. It may negatively impact the color accuracy of your screen, but therefore is less stressful for your eyes. As well as when using smartphones, it is recommended to always use backlines when staring at the screen. On PCs, it can cause much faster digital eye strain than on smartphones because of the bigger display. A problem that isn't so prominent on PCs compared to your smartphones is the hygiene. Your smartphone you take everywhere with you. Many people also use it on the toilet to check news, etc. PCs are bigger, heavier and not as mobile. That's why the hygiene may not be as bad as on your smartphone. Still, consider to regularly wipe your keyboard and mouse with a clean, dry, ideally microfiber cloth to get rid of any dirt. Now let's talk about headphones. You can find them in many different shapes and forms for various different use cases. What could possibly go wrong? There are 3 factors that together define the grade of hearing damage, as the US Department of Health and Human Services states: the loudness of sound, duration of listening, and distance from your ears. Loudness of sound. Modern headphones of all types nowadays support loud sound without noticeable distortion, so it's up to you to regulate it. You will notice by yourself when it gets too loud and can turn down the volume, right? Not necessarily. Our ears can be tricked by how loud we perceive sound. Focusing sound waves directly into your ear through, for example, earbuds can expose your ears to more decibel, that means higher loudness of sound, than if you would listen to a speaker at the same perceived volume somewhere in your room. This is where the distance comes into play. The closer you are to the source of the sound, the higher is the risk to damage your ears through it. The third factor is the time of sound exposure. The longer you listen to music or podcasts over 85 decibels, the more likely you are going to have hearing damage. What are the measures you can take to prevent ear damage and listen to audio safely? The nearer the audio source is to your ear, the more careful you should be with the volume. Ideally, you should listen to the music at a slightly lower volume than you think is still good for you. Make sure your ears aren't exposed to hour-long hearing sessions by taking pauses in between. This decreases the risk of potentially damaging your ears. Remember, you yourself can't really define if the audio is actually too loud or not. Another important aspect when looking at headphones is the hygiene. Wearing on or over-ear headphones for a longer period of time causes you to sweat. Therefore, you should clean the ear cups from time to time with a clean piece of cloth. Where hygiene plays an even more important role is when you use in-ear headphones, which you place directly into your ear channel. Depending on the type of ears you have, the in-ear headphones could already be full of earwax after one longer audio session. You don't want to put this back into your ears the next time. It can cause your ears to get infected and will also compromise the sound experience by blocking some of the audio off. An issue that some audio listeners can relate to and others not is the problem of noise-cancelling headphones causing headaches, dizziness and ear pressure. Active noise-cancelling headphones cancel out low-frequency sounds, which may trick your ear into thinking that the air density inside your ear is higher compared to the air density outside of your ear. But not everyone experiences those symptoms. Some people adapt well to active noise cancelling and others don't. So before buying noise-cancelling headphones, you should try them out for at least a couple of minutes with ANC on in order to be sure you won't have any of the described symptoms. If you do experience headaches, dizziness or ear pressure, then passive noise-cancelling headphones are the way to go for you. Passive noise-cancelling headphones just make sure that they seal off your ears as good as possible by covering the whole ear. Other issues that could occur from headphones are headaches because the headphones don't fit very well, are too tight or too heavy. To avoid such scenarios, trying out the headphones in an actual store is a good idea. What did we learn? There are many different definitions about what digitalization actually describes. The permanent move from the real physical world to the digital non-physical world, as I defined digitalization for myself, play a major role in our everyday life. That's why it is important to look at health effects that are caused by digitalization. Different categories of tech devices come with different kind of health risks. Preventing or treating physical health issues caused by digitalization is totally possible. If you experience intense pain and you think that the suggested tips or other exercises other people recommend don't help, please visit a medical professional that can evaluate what caused the health issue and what can be done about it. That said, I hope you learned something today and can prevent many health issues related to digitalization in the future. I wish you a great day and I hope to see you soon. Bye.